There was clearly some cause for concern with the CBC report identifying Sunnybrook as having a high rate of patients who die within 5 days of surgery. It's important to keep that information in context. Sunnybrook is the home to the largest trauma center in Canada. In fact, patients come to Sunnybrook because they have a very high risk of death. When we look at the types of cases where there are early deaths, it is evident that almost a third of these are our most severely injured patients. In spite of this, over 90% of our critically injured patients survive. And when you look at our overall mortality rates at Sunnybrook, our HSMR, which is the hospitalized standardized mortality ratio, is 90, which is better than most centers in the province.
Now, while these reports offer the public a glimpse into the performance of an organization, people must be cautious about comparing organizations and choosing their hospitals based on this data alone. We need to reassure our patients and their families, those that are currently receiving care at Sunnybrook, that the care we deliver is of the highest standard in terms of safety and compassion. Given the wide variety in patient populations served at various hospitals, those who have complex provincial programs versus community hospitals, it is difficult to draw direct comparisons among different organizations based on the data presented in these studies. Sunnybrook's overall 30-day readmission rate is above average, and we have been aware of this rate for some time. We know that this higher rate of readmission at 30 days is due to the prevalence of a large number of regional programs and services that provide care for patients who have the most complex illnesses and injuries and illnesses such as stroke, burns, trauma, and cancer. In many of these cases, readmissions are planned and necessary, and we also know that very few are unavoidable.